Safety is paramount at Providence Health Care. The purpose of this video is to show the basics of how to use a ceiling lift safely. We have a safe patient handling policy to minimize risk of injuries. This means that if a patient is dependent, healthcare providers are to use equipment such as a ceiling lift instead of moving patients manually with a sliding sheet or force. Ceiling lifts are available to staff to provide safe patient handling support when the patient needs to be repositioned, transferred, or in the event the patient has fallen within the area covered by the XY gantry. As part of the point of care assessment, ensure that the carry bar is in good condition and that the black carry strap is not twisted or fraying. Check the ceiling lift weight capacity on the motor to ensure the patient is within the limit. Most ceiling lifts at PHC can handle at least 400 pounds. If a patient is over the weight limit, request maintenance to swap out the motor to one with a higher weight capacity, as long as it's within the XY gantry weight limit. It requires very little effort to manually move the motor along its XY gantry to the desired location. Note the color of the small circular light. Red means that it is not ready for use and needs to be charged. Yellow means the motor is charging as it sits at the docking station. Green means that it is ready for use. It is important to know the emergency features of all patient handling equipment. If you are unable to lower a patient down to safety once they are raised, pull down on the red strap. This will lower the patient down at a steady pace. Notify your leadership team to fill out a maintenance requisition to repair the ceiling lift unless the battery just needs to be charged. Push back the emergency tab to resume normal use of the ceiling lift. When you are done with the ceiling lift, return the motor to the docking station so that it can be charged. At New St. Paul's Hospital, new motors may be charged anywhere within the gantry.